Good afternoon and welcome to today's program titled The Gut-Brain Pain Connection. I'm Gary Enos, editor of Addiction Professional. Today's program is sponsored by Sierra Tucson. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, we have a few details we'd like to go over. To submit a question or a technical issue, please use the Q&A area below the slides at any time. You do not have to wait until the end of the program. To download a copy of the presentation, please click the link in the Resources tab to the right of your slides. I have a special note about CE credit. To get your CE, you must watch the program all the way through the Q&A section at the end of the presentation. At the end, do not leave the web page. The site will automatically redirect you to a survey. This must be completed in order to generate your CE certificate. For those watching in a group, please download the group submission guide in the Resources tab and follow the instructions provided. Please note that CE credit is not available for the archived webinar. It is only available for the live event. And for those of you who tweet, please tweet along with us using the hashtag APLiveWebinar. At this time, it is my pleasure to introduce our speaker, Maureen Schwehr. Maureen is Sierra Tucson's Director of Integrative Services. Her department provides a unique combination of physical and mental health support for residents. Dr. Schwehr oversees a team of experienced and talented staff whose services include naturopathic medical consults, acupuncture, physical therapy, chiropractic services, massage therapy, shiatsu, zero balancing, somato-emotional release, and craniosacral therapy. Thank you, Dr. Schwehr, for taking the time to speak with us today, and with that, the audience is yours.
Thank you. I want to welcome everyone to this webinar. Today we're going to be talking about one of my favorite topics, which is the relationship between our digestive system and our physical and mental health. I am a naturopathic doctor, and I am going to take a minute to explain that because there is some confusion out there. And I'm sorry, I'm just getting used to clicking these slides apparently. So there are 6 schools in the United States that have 4-year medical degrees in naturopathic medicine. We have separate medical schools in the same way that osteopathic doctors do. And this is an overview on this slide of our education, comparing it to other medical schools in the country. I went to Bastyr University, which is the second from the left here. I had the same anatomy, biochemistry, all the basic sciences as in other medical schools. I learned about drugs and pharmacology with a special emphasis on drug-herb, and drug-nutrient interactions. But in addition, I had a lot of training on nutrition. I learned about botanical medicine, supplements, homeopathy. And in general, as a naturopathic doctor, my belief is that the body's natural state is health. And so I always think of myself as a detective trying to figure out where things went wrong and using the most natural things possible to bring us back into balance. States license their medical professionals individually. This is a slide that shows the green areas are states that have licensed naturopathic laws. So we are currently licensed in 19 states. I practice in Arizona. In this state, I'm a fully licensed doctor. I can prescribe most medications. I can order labs. In Washington State, where I was trained, all of that is true, and insurance is required to cover us. So you can see more common to have licensure right now on the coast, but it's growing in popularity all the time. I'm going to start today with a case study because I think it will help you understand how I look at individuals. And this was actually the very first person that ever came to see me when I was a new doctor. This was a 46-year-old woman. She was suffering at this time from pretty severe depression. She had a history of childhood trauma, but had done pretty well in her adult life, had a few episodes of mild depression, but had good family support, a job that she really liked. And then she decided she needed to lose weight. And at that time, the diets that were very popular were the no-carb diet. So she went on this no-carb diet, and she started to lose weight. But what also started happening was that she started to be tired, and her mood dropped. So she went to her gynecologist for her annual visit and told her about the depression and the fatigue, also told her that her menstrual cycles were irregular. So what her doctor did was put her on some birth control pills in order to balance her hormones and regulate her cycles. So when she started taking those birth control pills, what happened is she went into a severe depression. She wasn't able to go to work. She was sleeping all the time. It was really a deeper depression than she'd ever had. So when she came to see me, what I did was a good history, and I'm always looking for what was going on at the time that this started. And the first thing I suspected was her diet. And when we have a no-carb diet, what happens is there's no carbohydrates, but that's where we get our B complex, our B vitamins. And we need B vitamins to make our neurotransmitters and our hormones. So I think the beginning of her problems, I suspected, were in her lack of B vitamins. So the second thing that seemed to happen is when she went on birth control pills, everything got worse. As women get older, at 46, she's in perimenopause. And at perimenopause, our hormones start to drop, both estrogen and progesterone, but progesterone often drops more quickly. So symptoms of low progesterone are depression, irritability, insomnia, mood swings, fatigue, basically PMS symptoms. So I suspected that when she went on birth control pills, which typically are very high in estrogen, that pushed her into kind of a chronic PMS mode, and that they caused the worsening of her depression. What I did was I told her that she needed to eat some whole grains. I put her on a very good B complex. I took her off the birth control pills because she didn't really care if her cycles were regulated, and I tested her hormones. And sure enough, progesterone was almost non-existent and estrogen was high. So I put her on some bioidentical progesterone cream. I talked to her about 10 days later, and she was a different person. She told me that her depression lifted pretty quickly after she went off the birth control pills, and she felt much better. So I started with this because it shows you how I look at different situations and how, as a naturopathic doctor, I try to look at all of the pieces. The other is this was such a strong case for how important those B vitamins are. So today when we talk about the effects of the gastrointestinal system on mood, there's sort of three big areas I'm going to talk about. The first is that nutrient absorption, which I think the first case study gave you an example of. The second is our enteric nervous system. I'm going to explain that in a minute. And then I'm going to finish up with intestinal microflora. And this is actually a new area where there is a lot of new research and so many new findings. So nutrient absorption. This slide gives us an overview of all the different locations in the gastrointestinal system and where we absorb the different nutrients. And they may be too small for you to see, but basically understand this. We are biochemical beings. We are like a biochemical machine. And so in order for our body to make neurotransmitters, to make muscles, to make skin, we have to take in nutrients, and then our body has to turn them into those substances. And the only way we can get nutrients in is through our digestive tract. So as a naturopathic doctor, I'm always talking to people about their digestion, because if we're not digesting and absorbing our nutrients, then we can't make our neurotransmitters and we can't be happy or healthy. So the different areas here are not as important as just the understanding that we need to have strong digestion in order to be healthy. The next slide here is going to show you one of my favorite pathways. So I am kind of a biochemical nerd. I loved biochemistry when I was in medical school. And this is a methylation pathway. And this is a pathway I used to actually look at a lot. I worked with kids on the autism spectrum. And this is a pathway that often has problems when children have autism. So this pathway is how we make some important nutrients. And if you look closely, serotonin, dopamine, glutathione, which is our major antioxidant. So the point of this is for you to understand how we need all these different pieces in order to make these important molecules. So if we are missing magnesium or folic acid, then our body isn't able to make that molecule. And if we don't have those building blocks, we're not going to feel well. And so often if this is overlooked, we may put someone on a medication and it may not work because they don't have the basic building blocks to make those. I used to work in an eating disorder facility, and what I would see, I think especially with the young girls, is they would come in. If someone is anorexic, they don't have the basic nutrients that they need. And often they were depressed, and then they'd be put on the medication. It wouldn't work. The dosage would go higher. It wouldn't work. They'd be put on a second medication. And sometimes I would have 15-year-old girls who would come in, and they might be on 5 or 6 medications, and they were somewhat catatonic, but they were still depressed. Once we started to feed them, everything changed. Once they started having those nutrients, we often had to really quickly lower those medications or eliminate them because once the nutrients were there, the medications would start to work. So the next area we're going to talk about is the enteric nervous system. So we know in our culture, in our vernacular, we have all these terms that show that we understand how tightly our brain and our gut are connected. Gut-wrenching experience, I feel like I was kicked in the gut, butterflies in the stomach. I think all of us have had that experience where something bad has happened and we felt it first in our digestive system. So the nervous system, our nervous system has a special connection to the GI system. So when we are embryos, before we are born, we have one tube of tissue. And what happens is that this single set of tissue separates, and part of it becomes our brain and spinal cord, and the other part becomes our digestive tract. So our brain and our digestive tract were once the same tissue. As they separate, there is maintained contact through the enteric nervous system. So we have these nerve fibers that directly connect our brain and our GI tract. And that is why we have such a quick and strong response to emotional signals. So this system functions autonomously, but it is modified by the other parts of our nervous system. So if everything is cool, if people are in a happy, parasympathetic rest and digest state, this system works on its own. And it works without a lot of input from us. But the problem starts coming in when we encounter stresses. So stress changes. I'm sure all of you have heard of our autonomic nervous system, the sympathetic versus parasympathetic. So this part of our nervous system is really designed to keep us away from danger. We have this nervous system where if we perceive danger, it in an instant changes everything. So one of the first things that happens when we go into that sympathetic mode, which is that fight or flight mode, is our body turns off unnecessary systems. And the first system it turns off is the digestive tract. We use a lot of energy, and it takes a lot of blood flow to digest and absorb our food. So that is turned off. That blood flow is shunted to our muscles, our heart rate changes, our breathing changes, our eyesight increases, and we really become machines that are meant to run. The problem is that if we live in a chronically stressful situation, that I have had patients who have basically had their digestive tract turned off because they have been in the sympathetic panic mode for years. And when that happens, it becomes part of this feed-forward loop. If someone is under chronic stress and they're not digesting their food, then that leads to less absorption. They may not be absorbing their medications properly. This leads to more depression, and it goes forward. And this is why I am always looking at this sympathetic state and using different techniques to bring people into a relaxed state so that they can digest their food and get the nutrients they need to be able to make their neurotransmitters. So there is a big association between GI concerns and mental health. These are a couple examples I found from studies. Irritable bowel syndrome. Irritable bowel syndrome increases the risk of subsequent depression, anxiety, insomnia, and bipolar disorder. So also those with active bipolar disorder, 29% of them, almost a third of them, will report that they have irritable bowel syndrome. So most of the time when I look at these studies, they sort of say this to say there's an association. So if you have someone with mental health issues, you should, have them go get this treated as well. But most of the studies I've seen aren't actually linking this. What I see is that this link is part of the problem. If someone has irritable bowel syndrome, that's typically they'll have diarrhea, constipation, bloating, abdominal discomfort. When this happens, it's a sign that their digestive system is off track, and it's a sign that they're not digesting their food well. And so I think that part of why they have an increased risk for depression, anxiety, insomnia, bipolar disorder is because they now don't have the nutrients they need for their body to make the neurotransmitters or the hormones they need to feel well. And I'm going to explain this a little more as we go through this. So now we're going to go to my favorite part of this, which is talking about gut bacteria. We all have 4 to 6 pounds of bacteria in our digestive tract. And yes, I was correct, 4 to 6 pounds of bacteria. That comes out to be 100 trillion microbes in our GI system. I think I read somewhere that we have more bacteria than we may have cells in our body. So we, as a species, have developed with that. We need these bacteria. They are our friends. And what we are learning more and more is that the type of bacteria, the number of bacteria, where they are in the digestive tract have a huge impact on our health. And I'm going to go through all of that. So part of what has changed is that in the last 10 years, we have developed DNA tests to be able to look at gut bacteria. It used to be that if I wanted to find out what kind of bacteria were in my digestive tract, what I would do is I would have take a stool sample, grow it out in a petri dish. It was slow, it was imperfect, and it didn't give you all the details. Now what we do is we can send samples through a DNA analysis, and we can tell to the very percentage what kind of bacteria are there because we look for the DNA markers. So this has changed everything. Now that we can assess that, there has been so many more studies that have given us the details on how much those bacteria impact our health. So benefits of our bacteria. The first is our immune system development. We are actually born, our digestive system is sterile, but we have these things in our digestive tract called Peyer's patches, and they are there to read the bacteria and the microbes that come through, and this becomes part of setting up our immune system. So our immune system starts in our digestive tract. And in a perfect world, a baby is born vaginally. They pick up the bacteria from their mother. That sets off a reaction that starts their immune system. And that is very important. If you have a child who is born with C-section, they are more likely to experience more health problems, more likely to be hospitalized, more likely to have asthma, eczema, and other conditions. Second, here is they crowd out pathogens. So our good bacteria keep us safe from bad bacteria. If we have a lot of good bacteria and we consume something with some pathogenic bacteria, those good guys often fight it off, and we don't even know it because it's doing their job. So it's very common if someone goes in, especially to the hospital, and it takes really powerful antibiotics that kill off all their good bacteria, that what they can get is an overgrowth. And C. difficile, which is listed here, is really the most difficult. It's called C. diff because it's difficult to kill, and people get very sick when they have this. That's why I always tell people that they should take probiotics, good bacteria, whenever they're taking an antibiotic. Candida, which is a yeast that all of us have, will also overgrow if we kill off the good bacteria. Nutrient production and absorption. It turns out that our bacteria actually create many of the vitamins in our body, including vitamin K, B vitamins, and short-chain fatty acids, and those are very important molecules, the short-chain fatty acids, that help to lower our inflammation. And they also create many of our neurotransmitters. So, serotonin production. Serotonin, we all know how important this is for our mental health. It's a two-step process. What happens is we eat protein, and that tryptophan that's in our gut is broken down to 5-hydroxytryptophan by the gut bacteria. That's the first step. We then absorb the 5-HTP, and then in our system and in our brain, we turn it into serotonin. If we don't have the right gut bacteria, we actually can't make serotonin. GABA, they have found 7 types of bacteria in the gut that that create GABA, which is that calming neurotransmitter, and its precursor. So this is kind of small for me to read. It probably is harder for you. If you get a copy, you can see it. This is a list of all the different kinds of bacteria and the molecules that it makes. And what this shows is the specific bacteria that have been shown to make dopamine, melatonin, GABA, serotonin. And so this list, we're adding to it all the time. Anti-melancholic microbes. I like that name, so I actually found it on a different study. What they found is they take germ-free mice. So what they actually do is take mice and do a C-section so that the little babies are born germ-free. And what they do is they raise those in a germ-free environment, and then they tested them. And what they found is that when they were germ-free, when they did not have those good bacteria in their gut, they had an overactive hypothalamic pituitary axis response to stress. So when those mice were stressed, they overreacted. They were more anxious and easily triggered than mice that had bacteria. Then what they did is they took some of those mice and they added the Bifidobacterium infantis, which is a very common good bacteria in children. And when they did, they found that the mice stopped being so overreactive. They were less anxious and less responsive. They also found that the germ-free mice had less noradrenaline, which is important for mood, and again, the 5-hydroxytryptophan, which is the precursor to serotonin. Do gut bacteria make mice brave? The answer is yes, they do. So they are able to, they have special mice that sadly are designed or bred to be anxious. And they know this because they'll put them in a maze, they hide in the corners, they won't come out for food, they act very scared. And so what they did is they took those mice, and with half of them, they gave them a broth that had Lactobacillus rhamnus in it for 28 days. And the other half, they did not. Those that were given the broth were much more fearless than the others. They came out, they ran the maze, they acted much different than the mice that did not have that broth. So adding that bacteria actually lowered their anxiety levels. All right, epigenetics. So the old model of our DNA is that we have DNA, it's a blueprint, and no matter what we do, that blueprint is going to be read one way. And what we have found in the last 10 years is that is not at all true. What happens is all of us have a blueprint, but what's going on in our body and in our environment changes how we read it. And so what they found is that the bacteria that is in the GI tract affect the expression of the genes in both human and mice intestinal tracts. So when they added different bacteria, they found that the bodies actually read their genes differently. So a good example of this, I went to a conference that was on breast cancer, and it has been shown in many studies that women who have a history of breast cancer, if they go to a vegetarian diet, it lowers their risk of breast cancer. So what they found is this: women's bodies make many different kinds of estrogen, and some of those estrogens are much more associated with excess growth and tumor production than other forms of estrogen. So women who consume meat, the bacteria in their gut, breaking it down, they send out a message that changes how we read the DNA that causes more prolific forms of estrogen. So women who were on a vegetarian diet had different bacteria in their gut, and those bacteria sent signals that actually changed the estrogen makeup to one that was less associated with breast cancer. So they have found that taking probiotics, adding them, does change gene expression. So there are now studies that link gut microbiome to autism, obesity, diabetes, Alzheimer's disease, asthma and allergies, Crohn's disease, hepatitis, several autoimmune diseases, peptic ulcers, cholesterol levels, cancer, and atherosclerosis. When I went online to look at this, I found thousands of studies on this, and more we're seeing that there is a direct relationship between those bacteria and many health states. Microbial neuroendocrinology, this is a nice word. This is a new branch of microbiology, and what this really shows is this. So far I have been telling you that the bacteria can change the hormones we make. What it also shows is that the hormones in our body affect the bacteria. So in this second example here, they found that catecholamines, that's epinephrine, norepinephrine, and dopamine, when there are higher levels of that, what they found is that some bacteria, the Clostridium, which can cause disease, are actually more virulent. So when people are stressed and have higher levels of catecholamines, the bacteria in their gut are more likely to make them sick. Serotonin, they have found, can modulate how pathogenic, so how sick we can get from different Pseudomonas species. And this makes a big difference because there's chronic infections by Pseudomonas can lead to a lot of chronic disease states, including some chronic asthma and lung problems. So inflammation. Inflammation is our body's way of trying to repair things, but chronic inflammation is when that repair gets out of whack, and what we get is this chronic inflammatory state. So fiber, when we consume fiber, and that's, from fruits, from vegetables, the bacteria in our gut break that down and create something called short-chain fatty acids. And this is especially important for the health of our large intestine, but it also, that signal of inflammation or stopping inflammation is absorbed into our whole body. So if we eat more fiber, if we have healthy bacteria and they make short-chain fatty acids, it actually will lower inflammation in the entire body. And so dysbiosis, that means dysbiosis is basically a term meaning we have the wrong kind of bacteria, the wrong amounts are in the wrong place. And so it can lead to increased inflammatory cytokines, and those cytokines can cause pain and discomfort throughout the body. This is just a slide to show how if we have dysbiosis, we can have more inflammation. And when we have healthy bacteria, the body is less inflamed. And this is strongly related to the pain connection. Probiotics protective against inflammation. This was a very interesting study. So scientists have found that if they inject D-galactose, which is a certain sugar, into the body of mice, what they get is inflammation in the brain that really mirrors Alzheimer's disease. And they are using this technique to study Alzheimer's. So the newest research in Alzheimer's is calling it type 3 diabetes. They're finding that high blood sugar levels causes inflammation that is in relationship to developing Alzheimer's. So what they found in these mice is after they gave them the D-galactose and they had the brain inflammation, for half of them they gave them probiotics. And when they did, the mice that got the strong probiotics did not show the inflammatory response. So the probiotics actually stop the inflammation that caused the damage to the brain. So this has huge implications for us. And after reading some of these articles, some of the doctors I work with now are doing probiotics daily because they feel like it's a strong enough relationship to show it may prevent Alzheimer's. So this is also really interesting. Gut bacteria seem to affect drug metabolism. So when we take a drug, the assumption is that we take a drug and all of us metabolize it in the same way and that it works the same way. But we all know from studies that how well someone responds to a medication is really variable. What this is showing is that the makeup of your gut bacteria actually makes a big difference in how you metabolize those drugs. So here are the drugs that have been tested. So L-DOPA, digoxin, simvastatin, very common drug. All of these, what kind of bacteria you have in your gut determines how you metabolize it and how effective that drug will be. So for me, that really raises the question of we haven't tested all these medications. So whenever I am meeting with an individual, if their digestion is off and if they have a lot of dysbiosis, digestive systems, then to me and their medications are not working, one of the first things I do is to try to give them a healthy digestive tract, because it could be that those bacteria are actually affecting how well they're metabolizing those medications. And I think this is an area that's going to have some huge implications in the future. So now we're going to talk quickly about functional digestive issues. As a naturopathic doctor, we work with a lot of functional health problems. And what that means is people are sort of basically okay. They may go to the doctor and say, they'll often come to me and they'll say, look, I feel awful. I have diarrhea all the time. My gut hurts, but I went to the GI doc. He said I'm fine. These sorts of things. So I'm more interested in having things be optimally running than I am sort of focusing on what the disease state is. So these are some common digestive issues that I work with. Dysbiosis, we talked about that, the wrong kind of bacteria. Candida overgrowth, that's all of us have candida, which is a yeast in our bodies, but if we kill off our good bacteria because of using antibiotics, then the candida can overgrow, and this causes inflammation, and it also causes cravings for simple carbohydrates. So irritable bowel syndrome, we're going to talk about that in a minute. Leaky gut is when our GI tract is more permeable, so larger molecules get into our system, and this can set off immune responses. And then now I'm going to talk more about this small intestine bacterial overgrowth, or SIBO. So irritable bowel syndrome is typically people will say that they experience pain, bloating, they'll have constipation or diarrhea, maybe back and forth. So irritable bowel syndrome is becoming more common. And when someone has irritable bowel syndrome, they often have other symptoms as well, including GERD, which is reflux, dyspepsia, which is an upset stomach, chronic headaches, fibromyalgia. 21% of patients with fibromyalgia have IBS. And they also have found that with anxiety and depression, almost 82% of them said that they had IBS symptoms. So this is really telling me that we need to look at the gut. So what has changed in the last several years is that we have a new way of looking at irritable bowel syndrome, and it is being highly linked to this, small intestine bacterial overgrowth. So what happens with SIBO is that of that 4 to 6 pounds of bacteria I talked about, it's supposed to mostly be hanging out in our large intestine. And what can happen is if we are on antibiotics, if we are taking opioids, which slow our digestive motility, if someone has chronic stress, so their digestive tract is turned off, what can happen is those bacteria end up being in the wrong place. And they're in the small intestine where they don't belong. So these are symptoms of SIBO: bloating, abdominal pain, bad breath, constipation, diarrhea, or both, difficulty gaining weight, and I would add difficulty losing weight, muscle pain, fatigue, irritable bowel syndrome, interstitial cystitis, which is a painful chronic bladder, is associated. Restless legs are highly associated with this. And what I'll see on tests is iron deficiency, and often people will have food intolerances, and sometimes they feel worse when I give them probiotics. So we talked about some of these causes: chronic stress, proton pump inhibitors, also because the acidity in the stomach changes things, chronic alcohol intake, and food intolerances. I think that an awful lot of people in our country don't digest dairy well, although they continue to have dairy in their diet. And when that happens, what I can see is that they will develop sort of chronic bloating and SIBO-like symptoms. So SIBO, you can test for this. There's a breath test. It's a little tricky, but it can be done. And so you actually can tell if there is an overgrowth. And treatments, what I typically do is I try to kill off the bad bacteria first. There are antibiotics, non-absorbable antibiotics that work for this. They're expensive and typically insurance won't cover it. I use herbs more often, such as berberine, garlic, oregano oil, to work with that. And maybe just to back up a second, what I first do is try to look at what the cause is. If the cause is chronic stress, then I try to insert some stress-reducing techniques or things to help lower that stress so their digestion moves. If the problem is dairy intake, then we may ask them to go without dairy for a while. I try to figure out what caused this and help to balance that first, and then I try to get rid of the the bacteria that don't belong there. And then later in treatment, I'll put back in the good bacteria with probiotics and other healing herbs. So this is a nice example. I told you that I used to work with kids on the autism spectrum, and this was Max. So when I had a private practice, a mom brought in this little guy, Max. He was 3 years old. He was not officially diagnosed with autism, but he looked very autistic. He had very little language. He basically at 3 could say no. Very little social interaction, never played with his brother, didn't interact with his mom. He had had a traumatic birth. He was sort of wedged into his mother in the wrong way, and what he was having at 3 were chronic swollen tonsils and chronic ear infections. His tonsils were so swollen that he actually had sleep apnea, and he was in a month going to be actually have his tonsils removed. He had had multiple rounds of antibiotics because of all the ear infections, and he was a very picky eater. Basically, he would eat pasta, pesto, dairy, and I would add to that sugar. He would drink a soda. But that was all he would eat, literally. So when I looked at Max, the first thing I was suspicious of was that dairy was not a good food for him. And part of that is that dairy is highly associated with chronic ear infections in children. It causes mucus and it causes those problems. Also, he loved dairy, and we sadly often crave the food that we are intolerant to. And his diet was very limited to this. That's really common in children on the spectrum. They'll often come in and they eat only wheat and dairy. And wheat and dairy are usually what we have to remove. So what I did with Max is I took dairy out of his diet, and I put him on a good probiotic, including Saccharomyces boulardii, which is a yeast. And the yeast actually kills off bad bacteria, and it kills candida. And I did some craniosacral therapy because of the trauma he had had at birth. So those are really the things I did with Max. And when he came back to me, I have to say Max was a completely new child. He had begun to talk. He would say whole sentences almost overnight. He started to talk. He started to interact with his family. His mom brought him and his little brother to the zoo, and he was showing his brother the other animals. His dad was on the floor exercising, and he ran up and started interacting with his dad. His tonsils went down. They normalized. He never did have to have them removed. No more chronic ear infections. And what we saw with Max is whenever his grandparents, who were from Italy, came to visit, Grandma loved to give him ice cream, and she loved to feed him pasta. And it was very difficult for her to understand why that was a bad idea. Every time she came in, he would get an ear infection, and he would start to regress a little. And then Mom would usually be able to clean up his diet and push him back. When I worked with autistic kids, there was a handful of them where I would change their diet, and they would actually stop being autistic. It did not work for everyone, but it really showed the power of those foods and how if there's food intolerances, and I think that through the bacterial overgrowth, that it was contributing to inflammation that was contributing to Max's problems. So again, what happened? Actually, the family there was a family history of dairy intolerance because they probably just didn't break it down. And then that dairy, when it wasn't broke down, the wrong bacteria started to grow. They were harmful. They created mucus and inflammatory markers that caused inflammation that probably went to his brain. The antibiotics killed the good bacteria, which made the harmful bacteria even more virulent. This is what we just talked about. So I actually do this talk at Sierra Tucson. I present it to our residents here so they understand these connections. And the overlying message is always these positive feedback loops. What often I find in health is something stressful happens. It can be a traumatic event, it can be an addiction, it can be an illness. And then what we as humans so often do is that we stop eating healthy foods in response to that. I know that's one of the first things I do. We eat more processed foods, and then sometimes the stress affects our immune system. We get sick, we go on antibiotics, or we start taking proton pump inhibitors because we have GERD, or pain medications, and that causes more difficulty for our digestive tract, and that changes the microbiome, and then we don't feel so well, And then this feed-forward loop continues. And so that's why I think it is so important to always look at digestion and nutrient intake as part of the picture here. So another case study. This was a 34-year-old woman that came to see me. She had depression, anxiety, and trauma. She was on an antidepressant that actually had worked very well for about 10 years. And when she came in, she said, I was on this medication, it worked great, and then it just stopped working. And I didn't know what to do, so I went off it. I went on something else. I tried taking it. I started working with it. It was just this whole mess, and she was very confused. So what I always do when that happens is I stop them and I say, what happened exactly around the time when this stopped working? Well, when the medication stopped working, right before that, she had lots of difficulties. She had to move with her family, lots of relationship difficulties, and so she was very, very stressed. And so it turned out that what happened is that stress started changing her digestion, and then, hold on, let me go back to the next slide here. So when this happened, wanted to make sure I got the details correct. So when she was having this stressful time, she started getting pneumonia, and she had recurrent pneumonia, and they started giving her stronger and stronger antibiotics. And so after being on those antibiotics, she started getting a lot of digestive issues and symptoms that mirrored the SIBO symptoms: restless legs, nausea, fatigue, muscle pain. Also, when I did her lab, she had iron deficiency and low vitamin D. So I think what happened with her is that she was on the medication, everything was okay, she had a lot of stress, she got sick, she went on antibiotics that messed with her digestive system more. She started getting basically irritable bowel syndrome that was messing with things. And then what was happening, I suspect, is that those changes in her bacteria changed how she was metabolizing that medication. So what I did is I treated her SIBO. I used berberine and peppermint oil. I gave her a good active B complex because I was suspicious she was low in Bs. We treated her iron deficiency and her vitamin D deficiency. After about 2 weeks, I added back some good bacteria, the probiotics and Saccharomyces boulardii. We changed her diet. I suspected dairy was not a good food, had her improve it, and we used genetic testing here to look at what medications would be the most helpful. Sorry, the slides are just delaying a little bit here on me. Hold on, I'm going to go back one more. I apologize for the delay. So what I found is she started to respond to her medication again. And I think she was such a good learning experience for me, because it gave me that opportunity to see how digestive things can really change how we metabolize medications. And it was later that I found that study that showed that there actually is a growing amount of studies that show that that is true. So what to do? It's always hard to give advice on something like this because everybody has individual problems and concerns, but in general, all of us need to be friends to our good bacteria. The bacteria in our gut were meant to be fed real foods. So eating real whole foods is very important. Our body needs fresh fruits and vegetables. It needs fiber to be able to have those bacteria be healthy. When we have processed foods, what often happens is they put things into the processed foods so that they will have shelf life. But those preservatives, what those preservatives are designed to do is to stop the growth of bacteria. So when we eat those foods, our good bacteria have a hard time breaking them down. So one of the best things we can do is eat real food. I also believe in fermented foods, probiotics. Every culture really across the world naturally, historically had fermented foods. My grandmother was German. We used to make sauerkraut when I was a kid in her house. Whether it's yogurt, whether it's kombucha, fermented foods are a great way to get good bacteria. And I will also just use probiotics if that's the easiest way to do it. So quality supplements. So the quality of probiotics, good bacteria, varies a lot. These are two companies that I really trust, Claire Labs and Genestra brands. They have really good supplements. Consumer Labs is an organization. You can get a membership online, and they actually test and rate supplements to see if what is on the label is in the supplement. And they have a lot of information about different studies. So you can always get a membership. It actually is not that expensive to do that, and it's a great way to get good information. All right, so it's time for us to go to the question and answer section, so I'm going to turn this over to our moderator.
Dr. Schwehr, thank you very much for a great presentation. And I want to thank the folks in the audience. We've had a number of great questions that have already come in. We would also like to remind you that you can still use the Q&A area below the slides to submit a question at any time, and we'll try to get through as many questions as we can in the remaining time. Dr. Schwehr, we had a general question about diet that I wanted to ask to open. The person asked, how long after a change in diet can one expect to see improvement if you're working with a patient that's undergoing a dietary change?
Well, that's a great question. It's always, sadly, all my answers always have it depends. So I'll give you a couple of examples to help you understand. Whenever I'm working with someone, if they have some really severe digestive symptoms, if they're bloated, if they have diarrhea, those sorts of things, often if we can figure out what food is a problem for them, if we eliminate that, they typically start to feel better within days. It's not uncommon for me to have individuals here where I suspect dairy. Again, dairy, I always suspected if there's been ear infections or if they crave dairy. And often within a couple of days, they start to feel better. Now, individuals that have been really treating their body poorly for a long time, I had a patient who I loved. She lived a very stressful life, ate a lot of fast food, not a lot of fruits and vegetables, was a smoker, and she actually developed lymphoma. And it scared her so much that she completely changed her diet. And she felt better within a week or so, but it took about a year for her body to actually replace everything so that there was to really get rid of some of the chronic problems that she had, because long-term repair takes longer.
Very good. Couple of questions about probiotics. One, is it possible to get too many probiotics in the gut? And then sort of a corollary to that from another participant in today's program, are there any situations in which you would not recommend starting a probiotic?
That's a great question. So if someone takes a probiotic and feels worse or feels more bloated, bloating is typically caused by the bacteria in our small intestine giving off gases. And so that's a sign that those bacteria aren't working properly. So if someone feels worse once they take a probiotic, they should stop taking it. It probably means that SIBO is there, and they should follow some of the other recommendations to kill off those bad bacteria first before adding it. If someone is on a strong antibiotic, a broad spectrum, meaning that it kills off most of the bacteria, then very high doses in the billions of bacteria are a good idea short term to be able to replenish those and sort of fight against. And I typically tell them to take it as far away from the antibiotic as possible. So beyond then that, I would say listening to your body and seeing how it feels is the best way to sort of see if the dosage is right.
Okay. Thanks so much. Also, a question that came in, Doctor, regarding SIBO. The person asks, how do you figure out what causes the SIBO? How would you determine if it's a dairy intolerance or stress versus something else?
So that's another great question. It's a lot of it on my part is taking a good history. And so I look at when things started, and often there is more than one factor. It could be that someone doesn't digest dairy very well, and that's all fine until they come through a stressful event, and then the two of those together don't work. And so whatever I suspect is a problem, whether it's stress or diet, I try to actually work on both of them at the same time so they get to a point where they feel better. So there are two ways to determine if you have a food intolerance that I'm aware of. One is an allergy elimination diet. If you go online, you can find lists of these. Basically, what someone does is for 3 weeks, they eliminate all the foods that are most commonly a problem for people. Sadly, they are also the foods most of us love to eat. They include dairy, wheat, soy, corn, eggs. So what someone can do is go on a very strict diet and follow that for 3 weeks and see if they feel better. The other way is through testing. There are blood tests that look for antibodies against foods, and that can be an easier way for some individuals to figure out what's going on. So it is a little bit of a puzzle, and I recommend most naturopathic doctors that I'm aware of work with GI complaints. We're trained strongly in that area, and if you find a naturopathic doctor, ask them if they work with SIBO. They can help you figure it out.
Great, thank you very much. A couple of specific questions about peppermint oil that you mentioned in your talk, so I wanted to ask you to elaborate on that. They wanted to know a little bit about a safe way to ingest and maybe what the proper use of peppermint oil might be for a patient.
Okay, so usually with digestive issues, I use enteric-coated peppermint oil, and that's commonly available. And what that means is the peppermint oil is not released in the stomach, it's released in the small intestines. And what's nice about peppermint oil is that it both kills off the bad bacteria for SIBO and it is antispasmodic. So I will use it when someone is having digestive pain or cramps. It's something we've used for irritable bowel syndrome for a long time. And so it can be a really nice supplement to help support that.
And then there was also a specific question about yogurt. The person asked, you mentioned yogurt. Do the probiotic benefits outweigh the dairy factor?
So, no, they do not if someone is intolerant to dairy. So often I will meet with someone and I'll say, do you have any foods that upset you? And they may say, well, I can't eat milk or I can't eat ice cream, but I eat yogurt. So if you don't do well with any form of dairy, whether it's ice cream or cheese, it's likely that the yogurt is not good for you as well. So if someone has a dairy intolerance, then I would suggest taking probiotics in pills. You can actually get, I don't consume dairy, and so I use a coconut milk yogurt that's very delicious. Or you could use some other fermented food like sauerkraut or kombucha.
Very good. Dr. Schwehr, I know you talked about this in your time, but I want to, because a couple of people continue to ask about this, I want to reiterate for the audience. Can you reiterate the probiotic brands that you would recommend that they consider?
Yes, and it's my understanding that they will be able to get a copy of my presentation. Is that true?
Correct. That's correct.
Okay. So Claire Labs is a company that makes many probiotics. Therabiotic Complete is a broad spectrum one that I use a lot. They also have special formulas. For instance, they have a woman's formula for women who might get chronic yeast infections. So they have some other specialty formulas, but all of them are high quality. And then Genestra is another company. They have something called HMF Forte, which is another broad spectrum probiotic. There have been lots of studies on sort of single bacteria probiotics, and those are sometimes prescribed because a study shows they're useful. But I say that that's limited because common sense tells me we need a lot of different good guys, and a study may show one is beneficial, but that's because studies are designed to look at one factor. And so most of the time I try to use a probiotic that has many different good bacteria because we don't have enough information to know what the exact perfect amounts are.
Great. I wanted to ask a more general question, Doctor, about evaluating. You talked a little bit about how to evaluate some of what's out there. We get headlines all the time about various supplements, and how would you help the audience gauge, how they can try to separate, fact from fiction, or, one particular study from a bigger body of research about a particular supplement? Any just general guidelines as to how programs out there and practitioners out there should look at some of what they hear out in the national media about supplements of various types?
No, that's a good question. I wish I had a very easy answer for you. The truth is that the supplements are not regulated, and so what is in a supplement bottle can be questionable. There are brands that will do more testing. There is a website, Emerson Ecologics, EMERSON Ecologics is a supplement distribution group, and they will only carry supplements which have been tested. The companies that make them test them to prove that what they're saying is in them is in them. And I think that that's a good way. You can search their site to see which brands are on there, and those are brands that are more trusted. I always use brands that have extra testing so I know what they're saying is true. As far as quality goes, you do need to be suspicious. If something is very inexpensive, it is more likely that it is not what it says. So whenever something is at Walgreens and it's 2 for $1 and a lot cheaper, the company that makes it probably doesn't do the extra work that it needs to make sure that there's still quality in that supplement. That is where that website that I listed can be helpful, because you can go on there and actually look at some of the studies that they've done as well. I wish there was a simple solution to this. As a doctor, I have brands that I trust and I can see what's going on. And so often working with a physician that works with supplements long term, they often know about the quality of what they recommend.
Excellent. And it looks like we have time for one more question, and I thank the audience again for its great participation. This has been tremendous. What dietary changes, supplements, et cetera, would you recommend for patients who are recovering from chemical dependency, Doctor?
Great question. So since I have to be general, in general, a B complex, highly absorbable B complex, is a great addition to most people's recovery, because so many alcohol depletes a lot of B vitamins. Other drugs also tend to do that. So, and B vitamins are very important for our neurotransmitter creation. So I would do that. I would encourage them to have their blood tested to look at their iron levels and their vitamin D levels, because those are often the first signs I see of depletion. Dietary-wise, I am such a believer in just whole foods. And you don't have to have a perfect diet. Adding some fresh fruits and vegetables is often a really good start, because then you're giving good things to the bacteria as you go towards healing. I think part of it is simply us. When I talk to my patients, I talk to them about how part of their recovery is starting to take care of themselves and letting their diet be part of their goal of showing to themselves that they care enough to, put good food in their body.
Good lessons for patients and good lessons for all of us, Dr. Schwehr. Thank you so much. That's going to be all the time we have for questions today, so I have some final instructions to pass along regarding CE credit. Again, please do not leave this page. Please continue to stay on the platform, and the site will automatically redirect you to a survey. This must be completed in order to generate your CE certificate. Again, for those watching in a group, Please download the group submission guide in the Resources tab to the right of the slides and follow the instructions provided. Please note that CE credit is not available for the archived webinar. It is only available for the live event today, May 10th, 2017. I want to thank Maureen Schwehr once again for an excellent presentation. I also would like to thank our sponsor, Sierra Tucson, for making today's program possible. Finally, thank you to you and our audience for participating today. We hope you'll join us in the future for another Addiction Professional webinar. This concludes today's presentation.